I will ask Anthony Panzera, Rebecca Bailey, and Paige Zaitlin to kick us off with the presentation entitled ATTAIN DC WIC, Advancing Telehealth Technology and Innovation in DC WIC.
So for those who don't know what WIC is the Special Supplemental Nutrition Program for women, infants, and children, and it's administered by the USDA's Food and Nutrition Service. The mission is to safeguard the health of women with limited income, infants, and children up to the age of 5 who are at nutritional risk. And so the premise of this particular project is based on the fact that DC WIC services are typically delivered in person at a local agency service site. So there's 4 local agencies in DC WIC, one being Unity Healthcare, Children's National, Mary Center, and Howard University Hospital, and they operate 15 service sites across DC. So typically participants go in person to receive services. However, they often face barriers to attending these in-person appointments due to transportation or childcare or having to take off of work. So with this in mind, and this is kind of like a national, like known barriers. And so with this in mind, USDA had awarded Tufts University a grant to evaluate the use of telehealth innovations in the delivery of the WIC nutrition education. And DC WIC, American University, and all 4 of our local agencies that I just mentioned submitted an application to Tufts for a sub-grant award to expand the use of our telehealth across all of our local agencies and really increase access to nutrition education by addressing these known barriers. So, and I just want to mention this grant was announced before the onset of COVID-19, but obviously the pandemic has sort of amplified the need and urgency for these types of telehealth evaluations to ensure, effective service delivery when in-person interactions are not possible. So that is the background. If you can go to the next slide. Great. So the 3 aims of this particular project were to evaluate the impact of existing telehealth-based nutrition education across all 4 of our local agencies, and then strategically plan for expanding and enhancing the use of telehealth for WIC nutrition education within our local agencies. And then lastly, explore methods to integrate WIC services into home visiting program services that are currently offered at some of our local agency sites. And with that, I will kick it over to Tony.
And so from this collaboration, our expected results are that our findings from this work will help create a coordination protocol for scaling telehealth at each DC WIC local agency and for facilitating home visiting program integration. We really think that integrating, at least to begin with, the WIC nutrition education component of WIC would be beneficial to coordinate and wrap around care for families that, especially the families that the WIC program serves. By evaluating, we also think that by evaluating the current impact and planning for the expansion of telehealth tools in a scaled and data-driven manner, our project will address known documented obstacles to accessing nutrition education, and also it will increase synergies across local services through coordination between WIC and other family-oriented health programs. Next slide, please. And so we're in the development stage where we've submitted an application for grant funding. We're still in the waiting period, but this is an opportunity for us to also engage with you all who work with the population that the WIC program touches. And so there will be a question and answer session immediately following, but we also want to hear from you about what you think in response to these questions. how has your use of telehealth services changed during COVID-19? In fact, this year, the WIC program in DC and other state agencies have been given waivers from the Food and Nutrition Service of the U.S. Department of Agriculture. As we're in this a period where we have certain aspects of the program waived so we can provide services remotely, we're learning about what that's like, what a remote service for WIC is, and how it's going for our clients. Another question to consider is, what barriers have you encountered when implementing telehealth? So on both sides, both from the staff side, but also the client side and the patient side. And then also, what services do you provide to families that could be made more valuable if connected to nutrition education? Nutrition education, it seems small, but it touches so many important aspects of growth and development. So thinking more intentionally about how nutrition education can plug into your services would help us in the planning stage and figure out what does coordination mean. Next slide. And so with that, I think we would like to thank everyone who participated in this grant application effort. And moving forward, should we receive the grant funding, in any event, we would love to continue collaboration. You see a number of people in front of you on the screen. Sarah Beckwith is the WIC director and a wonderful leader, and Odie Boateng at Mary Center, and my colleague, Dr. Owens-Young, and Dr. Snelling at American University, and our collaborators at Mary Center, Howard University, and Children's National WIC local agencies. It's been a wonderful collaboration, and we look forward to your questions.
Great, thank you so much. We'll just take a few moments to ask anyone with questions for this group to go ahead and write them into the chat. Again, we're using the type chat to submit the questions. I'll read them out loud and then ask the presenters to make sure they're unmuted when they speak. We'll go from there. Sorry, that was my 5-minute timer. So just a few moments for questions to be submitted to this group. All right, we've got a question from James Wong. How would you reach new WIC clients if we have increased telemedicine visits and less in-person visits to the clinics?
I'm happy to take that one. If Rebecca, would you? I want to leave space for my colleagues. So Paige and Rebecca, if you could respond. One of the ways that potential WIC clients, especially coming from either a pediatrician's office or a primary care office, one of the important opportunities that the program has to get new clients are through those initial contacts, and it's those professionals, nurses, doctors, those that are supporting maternal and child health that can inform families about WIC services. And so one way through telemedicine visits and less in-person visits is number one on the back end for healthcare providers to connect with staff like Paige and others at local agencies to notify of an individual and make that connection. In addition, and I'm sure Rebecca can speak to this, if there's any opportunity for the local agency and offices that are in other medical and social service provider offices to connect through telemedicine tools like DoxyMe or other scheduling platforms.
Can I just also add, I mean, obviously I can only speak to what Unity is doing so far, But what we are doing is working on getting our staff access to ECW, so that will also facilitate the referrals, especially now that everything is telemedicine. We've been using DoxyMe as well, which our clients are kind of, they're not sure about yet, but we're working on that. And actually I can speak to the next question if that's okay.
Sure. Do you mind if I just read the question out loud?
Sure.
So the question is if there's any plan to roll this education into already existing virtual education, like centering pregnancy, which we have already at Unity.
Yeah, so first of all, we would really love to be linked in with centering. I know that we've had one of our nutritionists do a little talk with one of the centering classes here. And since when I used to work at Mary's Center, we would frequently go over there when centering was in person and, do education and use that to make sure that we get those clients enrolled in WIC if they're eligible. So since centering kicked off here at Unity, we'd really like to do that. So we can definitely do it, we could do it in person whenever that resumes. We can do it on telehealth right now.
Great, thank you. I'll give just another few minutes to see if any other questions come in through the chat. Another question, is there any food delivery component?
I feel like all of us can take this question, but I'll be brief. Part of the benefits of the WIC program is a food package prescription, and that is specifically tailored for the participant, and we use these certification categories. So woman, infant, child, and if woman, at what stage in her experience as a pregnant person or a mother. And so that we provide those benefits across in many different states through an EBT card, in others, and I believe here paper checks, and those are specified for particular products and amounts, which differs the WIC program from programs like SNAP, which was formerly known as food stamps. So that's how the program works. The WIC nutritionists work directly with families and talk about their nutritional needs. And then within the WIC food package, those are provided to clients, and then they go shop at WIC approved vendors to redeem those benefits.
Great, thank you. And Paige, I see that you've entered your email address into the chat. So great to see some more potential collaborations cropping up here as well. All right, well, thank you all very much.
All right, thank you, everyone. Thanks, Nicole. Okay, so today I will be presenting on Unity's infection control team's response to COVID-19. You can see here are the list of every one of the infection control team members, and I would like to start off by just thanking them for such a wonderful job. Next slide. As we know, the COVID-19 outbreak actually began in late December of 2019, but in March, the World Health Organization coined it as a global pandemic. Healthcare workers are at risk for getting COVID-19, and for this reason, the leadership at Unity decided to put in place an infection control team who would help mitigate this risk. Next slide. The infection control team is led by a registered nurse, a vision of our clinical leadership. The team consists of 3 international graduate doctors working in research, 1 medical assistant, and 1 administrative assistant. The team is advised by our CMO, our Chief Quality Officer, and our Director of Infectious Disease, while we follow CDC guidelines and DC Department of Health. The team works to recognize and correctly identify exposed or infected personnel with COVID-19, helping to mitigate the risk. The mitigation is done through offering diagnostic testing, engaging in contact tracing, and reinforcing interdepartmental education. Next slide. So how is Unity Healthcare containing the spread? We use what we call the 5 points of infection control. Daily self-attestation. Every employee would wake up, attest to their health, that they're not having COVID-related symptoms. We also mandate the use of masks at all times, appropriate social distancing as regulated by the CDC of 6 feet. We also practice continuous hand hygiene and also disinfecting surfaces after each use. For example, when a shared area is used, we, highly recommend that each employee or staff wipes down the surface. Lastly, we emphasize on mandatory use of full PPE when evaluating a person who's suspected with COVID-19. This includes the face shields, the gowns, shoe covering, full PPE at all times. Next slide. So this diagram here shows our weekly trends and exposure of exposure and infection. It's from March 15th, 2020 to September 19th, 2020. The green lines show those in some form of quarantine or isolation. The orange lines show employees who tested positive during that time frame. At the earlier onset of the pandemic, we saw a lot of employees with symptoms, and a good number of them did test positive. We saw these numbers decrease as we introduced and maintained our 5 points of infection control, especially self-attestation, which played a big role in ensuring that our green and orange numbers stayed low. Next slide. So how did the infection control team help with containing the spread at Unity? The infection control team's role has been very impactful in containing the spread. Our team is diverse and offers multi-language communication for our non-English speaking employees. We prepare and plan the day during our morning daily huddles so that we can provide our employees with symptoms and with symptom monitoring and follow-up. All employees have a 24-hour access to the team for questions and concerns. There's also availability of testing in a voluntary manner, which has promoted a sense of trust and transparency throughout the organization. Next slide. I'd like to conclude this presentation by highlighting some of our wins. A major concern for many healthcare organizations is maintaining a workforce that guarantees safe patient care, especially now during COVID. Unity has reduced this concern by implementing an infection control team that addresses exposure in a timely manner, ultimately impacting the entire Unity healthcare community in a positive way. Also, working in a centralized way, the infection control team has a more complete oversight with any potential COVID-19 exposure or infection with its employees. Also helpful is the great efforts from other members of different departments like EEE and our clinical leadership who also serve as advisors. Unity's employees have all played a huge role in reducing the spread by adhering to the 5 points of infection control, but most importantly, attesting to their health daily. These measures and success of Unity's infection control team can be used as a model for other organizations, internationally, locally, and of course, globally. Finally, our team has enjoyed and learned a lot from this experience while being mindful of some challenges and sensitivity of controlling the spread of COVID-19. And we continue to take into consideration that this is a new and global pandemic. This concludes my presentation. I will take feedback and questions at this time.
Great. Thank you, Hannah, for sharing the important work of your team. We'll open it up for a question and answer session now. So if anyone has any questions for Hannah about the work of the infection control team here at Unity, please go ahead and enter them into the chat. Well, I'm seeing one from Dr. Wong. Hannah, the question is, there must be some challenges to daily self-attestation. What have you learned from encouraging staff to self-attest? What are the next steps?
You're correct. We have seen a lot of challenges and difficulties with self-attesting. One thing we're looking at as the infection control team right now is looking at the process in which we make it convenient or make it accessible for our staff. One of the things we're looking at is probably enhancing like the technology using QR codes to increase compliance. The next steps right now is that we're doing an audit of all the health centers who attest and seeing what the challenges are from leadership, seeing what the challenges are from the staff. And we're hoping that we would take the information that we get and hopefully put it into action and make improvements in such a way that we can encourage compliance.
Great, thank you, Hannah. Another question, what challenges do you anticipate with flu season on its way?
We anticipate that, we would be getting a lot more phone calls and we'll be reaching, our staff will be reaching out to us, but we're well prepared for that. One thing we want to emphasize on is we would like to roll out the difference between COVID-19 symptoms and flu symptoms. And another thing that we're pushing out this year is ensuring that all our employees get the flu shot to reduce the risk of actually even getting the flu. We will continue to offer volunteer testing. We'll continue to offer antibody testing, and we hope that our employees would, make use of the resources that we put out and we roll out during the season.
Another question in the chat, how confident are you that self-attestation is a valid proxy for in-person screening?
The science behind the self-attestation is really using the honor code, knowing that you're coming to work to not only take care of your patients, but also being respectful of, your colleagues and, your patients. So if you wake up in the morning and you do feel sick, we expect for you to reach out to an infection control team. If you need to reach out to your doctors, get tested. The whole point of attesting is to say, hey, I'm coming to work today and I'm really going to give my best. And giving your best really means, attesting to good health and not putting anyone else at risk. Right. And if you're sick, stay home.
There you go. A question about rapid flu testing. Is there any chance of getting rapid flu testing?
I am not sure of that, but I anticipate that if we do have access, or if it's going to be rolled out to our employees, we'll get some guidance by our senior clinical leadership.
And Salifa is weighing in saying, yes, we are planning on purchasing some.
Thank you. Thank you, Salifa. That's our VP of Nursing.
All right, so just another minute or so. I'll give it a little time to see if any more questions roll in for Hannah, George.
Thank you. As we wait for questions, I would like to give again kudos to the infection control team members. These are our team is made up of different folks across Unity who've come together for this cause. We're constantly learning, looking at evidence-based practice, making sure that we're up to date with CDC guidelines and also the guidelines from DC Health. So kudos to everyone and all our advisors.
Agreed. We'll wrap up with one last question, Hannah. As schools may start to allow in-person and non-COVID febrile illnesses in children increase, how will we manage these patients?
Really, it would really just boil down again to, following our CDC guidelines, which is everyone in a mask, 6 feet, hand hygiene, attesting to health. We really hope that we'll continue to use appropriate tools for screening everyone who's screening patients, taking care of patients with COVID to be in the right PPE. And again, as long as we make sure that our patients come in with a mask, our staff are in a mask, I think we should be able to mitigate some of the risk of, increasing the spread.
Great.
All right. Hi, good afternoon. My name is Jordanus. I am LPN. I work at Parkside. I'm here today to talk about nurse-led FluFit clinic. What is it? FluFit clinic is the nationwide program. It is done in variety of setting. It does not need a lot of resource or provider. When they come patients, we give them the kit. When they come patients to get the flu shot, we give them the kit to take home to test by themselves for the colon cancer screen. And then it looks like this as the picture shown. Next page. How did we identify those patients? We went to the Azara list to identify the patients who are seen within Parkside in the last year, and they have to be 50 years plus. And also those patients, they have to be already had a flu shot and then fit test in the past. And also they need to be due for their fit test within next 2 months. And it's like a hanging fruit, a low hanging fruit. We also send letters to 116 patients. Next page. How did we set up the clinic? We got the table set up with the laptop at the designated area and designated datas. It's just like 1 to 2 days, 1 to 2 half days, and they register per week. They register at the table for a nurse visit. We do flu shot. Before they leave, we give them the kit, and also we verify. Sometimes they come out of the list. We have to verify again if they are due or not. And also if they're not familiar, we do a little demo at the table. Next page. Out of those 116 patients, 17 patients came to the clinic, 14 returned fit, 3 did not responded for the, did not come to the clinic, but responded by the outreach. 22 completed by PCP, 77, they did not show up. And in addition, 36 nurse visits, overall of the 17, I don't want to forget that. Out of those 17% patients, 82% completion rate. Additional 36 nurse visits were completed for flu shots and fit, and also from these 36 people are out of the list, from the original list, from the, I'm talking about 116 patients. They just showed up, and then we give them this opportunity. Next page, sorry. How, in a conclusion, would we do it again? If you ask me that question, yes, definitely we do it because our patients enjoyed it, and also it increased a nurse visit, billable visit, and also we need we had I enjoyed as well with the patient to me, and the patients enjoyed it the way we set up and everything. What lesson we learned? We learned that we have to ensure for next time we have enough nursing coverage on the floor. Some days I have to cut the clinic because of the short staff or to help with other tasks. We need to have provider champion to call for the abnormal results and to order also the GI referrals. we need to have, we have to think about having patients mail in the samples to increase the success rate as well. And we have to update chart to know that person was mailed later so that others will know they need a fit test. Many letters came back, and we have to ensure demographics are updated, and we can only text cell phones. Next page. At last, is there any questions? I would like to thank the Parkside leadership and staff and the nurses also, especially Dr. Chapman for selfless encouragement in health.
Thank you so much. That was an excellent presentation. We have a question from Dr. Slater. Is there any option for mailing back the fit tests?
Say it again.
Is there any option for patients to mail back the fit tests?
That's why my main concern right now that I brought that it's up to Unity if they let them to have patients to mail it in. I brought it on my what we learned that patients we have to they have to mail it in. They be able. I'm sorry. Yeah, we have to press that to start patient to mail in the samples. So far, we have not done it yet. They bring it to the in person to the Parkside to other clinics. That's what we have to work on.
Great. Another question, will this happen again this fall? I wonder if more patients will get flu shots at pharmacies this year.
I hope so. That would be good to increase a flu shot so people, they don't miss when they come to the pharmacy. That's my, I would love, when they come to pick up their prescriptions, they can do that. This is another option as well, but it's up to clinic up to Unity to start that kind of way.
Have you noticed other teams at Parkside increasing their flu and fit testing during your campaign? As in, they could also do it this year.
Yeah, it could increase because when I do the FluFit clinic, I can see a lot of people, as I read earlier, 36 patients. They came to the clinic out of the 116 letters we sent. I think that there are more, so it's yeah, they can. It would be increasing. I believe they can increase the visit without even the FluFit clinic.
Great. All right.
If I understand it right, did I answer it? I'm not sure.
I think Dr. Wong was asking if other teams might have kind of in response to the initiative that you were showing, maybe had a kind of a trickle effect on the rest of the health center as well in a positive way. If you've had any kind of indication that that might be happening.
Yeah, I hope so. I hope so. It will, yeah, increase the visits. It will affect people because when the way I do it last year, it was really enjoyable and beautiful. I think everybody can enjoy doing it. That I enjoyed it. Patient enjoyed it. Why not?
Great. Well, your enthusiasm is contagious. So thank you for sharing that with us and all of your hard work.
Thank you.
Hello, everybody. My name is James Wong. I'm a family medicine physician at Upper Cardozo Health Center. I'm here to talk about BikeRx, Community Partners Program and impact on health. Go to the next slide. So for those who don't know who what Capital Bikeshare is, I think a lot of us are used to seeing the red bikes around like all the monuments and tourist spots in DC. But actually, we can consider the Capital Bikeshare as a public transit system. There's over 4,500 bikes, 4,500 bikes at over 500 stations in the DMV area. It increases transit options. It can be a transit extender. It can also help people at night when there's less frequency buses or no buses. It can help you save time and money. As I mentioned, it connects you to other transit. It can add physical activity to your daily life, and it's also good for the environment. So aside from the tourists who use the bike share per ride, you can pay for a membership of $85 a year, which includes up to 30 minutes per trip. Next slide, please. So back in 2013, Capital Bike Share did a survey of their members. And what they found was that the average age of their members were less than 44. The income, a little less than half of their members had an income greater than 100,000 per year, and then the majority had a college degree or higher, and 74% identified as white. So I wonder what folks think about that in terms of a bike share program in DC. For its residents. What do people think about those statistics and how it compares to like what they think about who lives here in DC? I'm sure many of you are wondering if that really reflects who's living here. And so if you click on the next slide, it should animate to the next. Yeah. So basically, U.S. Census data of DC, the median income is around $65,000. Around half of its residents hold a bachelor's degree or higher. Only about a third are white, and half are African American. And so Capital Bike Share looked at this data and realized that their members did not reflect the people who live here in DC. And so that kind of what led to the creation of the Community Partners Program. Around this time is when I actually moved to DC and started working at Unity. And I heard about another bike share program in Boston that has subsidized or reduced bike share memberships. And so I had contacted Capital Bike Share around the same time. They were thinking about how they can make this more equitable. So if you go to the next slide. So Capital Bike Share met with many different stakeholders, different community groups around this idea of equity. And so if you can look in the upper right-hand corner, we have this, the two concepts of equality versus equity. And so, when you think about equality, it means that everyone gets the same thing, no matter, where they're living, their ability to ride a bike. And so if you really want to take a equity approach, we really are trying to design or say to everyone that we value them equally, and that we really want to optimize the conditions in which people were born, grow, live, work, learn, and age. And so in this case, you can see the bikes here are created to meet or match that person's level of ability. And so, when we think about equity, we really want to try to make things equitable and attainable to all people. And so after many meetings and conversations, the Community Partners Program was developed. So instead of $85 a year, they saw that that was a barrier to many folks in DC. So they reduced the cost of annual membership to $5. They noted from people they talked to that the Capital Bike Share stations were often sometimes too far, or not, there weren't that many in certain neighborhoods or parts of the city. So they gave, so there's up to 60 minutes per ride that's free instead of 30 minutes. And they also wanted to be, they were concerned about people's safety and that maybe people didn't have a lot of experience riding bikes. So being a part of this program, all members get a free helmet, and optional training and safety classes through WABA, which is the Washington Area Bicycle Association. And ultimately, we say 60 minutes, but there were no usage fees, so if people had the bike for 2 hours, 3 hours, they would normally pay an extra amount, but for people in this program, they would not get a usage fee. And so if you go to the next slide, Capital Bikeshare reviewed the members of the Community Partners Program. And so we saw that in terms of the demographics, it really shifted, and that a third of the members were more than 50 years old. The annual household income was less than $25,000 for the majority of participants. 20% of people in the program had 20% with college degree, and almost everyone did not identify as white. Next program. So it really did help reduce the barriers. And one thing I forgot to mention was that another barrier to accessing Capital Bikeshare to become a member is that you need a credit card. And so for many of our patients and clients, they might be underbanked and not have credit cards, so they weren't able to sign up for memberships that way. So basically the $5 could be paid in cash, and that would be to the partnering organization, which Unity Healthcare was one of the inaugural partners. And so you can see here, I went to the event where they announced the launch of the Community Partners Program. And then in terms of what we had to do at Unity, so because of the $5 that are paid in cash, it was actually a big barrier in implementing this program at all the Unity sites, because in terms of just the transaction of money, it's really hard to do without a cashier. And so Upper Cardozo is the only health center that had a cashier at the time. And so we launched the program at Upper Cardozo, and this is the most current flyer that we have. And so really advertising to our patient population at Upper Cardozo in English and Spanish. And then we had, there's always a social services person that was able to help sign clients up through a portal and then collect the $5. As well as show clients how to use the bikes, because we have a bike share dock right across the street from the health center. And so it's been fairly successful at Upper Cardozo. And so if we go to the next slide. So actually last year, we won an award from Capital Bikeshare for having the most trips taken by our members. In 2019, we had 92 members who took a total trip of over 11,000 trips, which averages about to 123 trips per member. So kudos to Viviana for signing all those people up, and to our patients for using Bikeshare. And then this is just some preliminary data for the next slide. So thanks to Stephen Radar, who helped run this report. So looking at, this is looking back to all the Bikeshare participants, and looking at, from their pre-enrollment and then post-enrollment, we did see somewhat a drop in weight and BMI, correlating that could be a correlation. You can say that there's a correlation between using Capital Bikeshare maybe because they're using Bikeshare for transportation rather than walking or sitting on the bus or driving. And so there's more to come in the next several months as we look at the data some more, but this is very promising in terms of almost like about a 4-pound drop in weight by participating in the program. On the next slide, sorry. And so these are just 2 testimonials from the participants. A lot of people were referred to Viviana because they, the primary care provider had noted that they might be a little overweight or had prediabetes. And so they providers thought this was a great way for folks to exercise and stay healthy. And then other people have commented that Capital Bikeshare, we had mentioned earlier, people use it as public transit. And so really people help save costs on public transit costs during the month. And so, if you're taking the bus twice a day during the month, it can be up to anywhere from $80, or the metro can be up to upwards of $160 a month that's saved from this program. So the next slide, please. So next steps. So we need to look at the data further and see really at what point do they enter into the program and exit. And then also we're trying to look at maybe some of the A1C and blood pressure data. And then I think it'd be interesting also to actually sit down and talk with some of the folks who have participated in terms of getting their feedback and thoughts, as I don't think there's much in the literature about Bikeshare programs and participants from our community. And so if you hit the next, should pop up. Go back, sorry. So thanks to Lester Wallace, who is the Community Partners Program representative, and to Viviana for enrolling all of these folks and storing the helmets and everything else on site, and to her predecessors, Kyle and Lucy, who helped sign up people. So right now, the Community Partners Program is kind of transitioned into something called Bikeshare for All. So anyone can sign up that has received some type of government assistance, and they can do it online, or they can do it through a Community Partners Program. But right now, Capital Bikeshare is trying to expand it across the city. And so before you had to sign up through a partnering organization, but now if you can show proof and send it via electronically, you can sign up that way. So thank you, everybody.
Great. Thank you, James. And just in the interest of making sure that we wrap up by about 2:55, I'll try and kind of summarize some of these questions so we can get to all of them. Can you talk about the age restrictions or limitations for membership?
Yeah, so basically they follow DC's helmet law. And so DC's helmet law says that you have to be 16, you can ride a bike without a helmet. So that's the opposite. So anyone who's 16 or over can sign up for Bikeshare.
And can you talk about the existing partnership with DCPS?
So there isn't any partnership with like DC Public Schools.
Yes.
But I think Lester is more than happy to work with programs and at schools. And so if people are interested in connecting Lester, he's like the outreach person. So he can work with schools. I know there's been an effort to increase like at least bike ridership in younger kids. And so from DC's PS, so I think there's that program. But in terms of Bikeshare, I think you'd have to coordinate with Capital Bikeshare with that.
Are there any plans to expand this beyond Upper Cardozo? So Dr. Myers is asking specifically, some CCNV patients are interested, but getting to that location is a barrier.
Yeah, we would love for more Unity sites to be involved. We just need a champion. It's like someone to take it on at that particular site, and that's been a struggle. And so if anyone on the staff at CCNV or any other health sites are interested in this program, we can definitely launch it there. We just need someone to be a champion and help folks sign up. But please reach out to me offline, and I would love to expand this across Unity.
Are there any other resources like educational events, resources beyond membership and helmets that participants receive as a part of their membership? Thinking about things that could be related to behavior change pre and post.
Oh, so aside from the free bike riding classes from WABA, which is the Washington Area Bicycle Association, I don't think there's anything particular to the program. Some other thoughts would be there's sometimes different bike groups that meet and just do bike rides around the city. So that might be a way to connect folks to resources in the city and have that motivation from other folks.
Can Unity employees take part of this Bikeshare partnership?
I think they can if they can provide a document if they are receiving any type, if they or anyone else are receiving any type of government assistance, they can sign up online, and I can put that in the chat. It's the Capital Bikeshare for All program.
Thank you. Dr. Slater asked, "It looks more impressive than 4 pounds?" ?
Is it more impressive than 4 pounds?
It looked like the slide looked more impressive than 4 pounds.
So you have to see. There might be. I wonder. Part of it, if you look at the different patients, but I wonder. Yeah, I think it's impressive, and I hope it holds true. But you have. I'll look at the data some more, and I'll get back to you on that. I know where to find you.
And then a follow-up question from Dr. Myers. I'm not sure if we already covered it explicitly, but is there, could you advise on the easiest way to get non-Cardozo patients involved?
Yeah, so I think if they're able to pay $5 online, then they can do the Capital Bikeshare pricing for all, and they can sign up that way easily.
Great. Well, I echo what Hannah George just wrote in the chat. Impressive work, James. And it's close to the time where we need to start making our way over to the keynote session, but I really want to thank everyone who attended this session today for all their questions, and really to the presenters for sharing all the fantastic work that they've been doing. So thank you, everyone. I hope everyone has a great rest of the afternoon.